After many questions and a bit of confusion over who would be next in line for a COVID-19 vaccine, DHS has announced who is in Phase 1B.
And that includes 5 groups of people, but they can't schedule their shots just yet. Amanda Quintana explains it all for us. Amanda?
Yes, well, just because the details of who is in 1B have been announced, that does not mean that they're actually eligible yet. There's still a lot of people in Group 1A who are eligible right now but haven't gotten a vaccine yet. And there's the 700,000 people who are 65 and older who were just made eligible yesterday.
We want everyone who wants a vaccine in Wisconsin to get a vaccine, and in the future that will be a reality. But with our current federal allocation, this is not a reality today.
Wisconsin is still only getting about 70,000 vaccine doses a week, not enough to move through the hundreds of thousands who are eligible to get one right now. Still, DHS is looking at the next group in line.
These are difficult decisions, and we do not take this responsibility lightly.
First priority is teachers, childcare workers, staff at after-school programs like the Boys and Girls Clubs, then people in Medicaid long-term care programs such as Family Care and Iris, then some essential workers in contact with the public like 911 operators, bus drivers, grocery store employees, farmers, and their employees. Only frontline healthcare workers were eligible in 1A, so this group includes other healthcare workers essential to operations. And lastly, people in congregate living, such as adult family homes, shelters, and prisons. All of these people will become eligible once about half of the people 65 and older get their vaccines. If Wisconsin supply stays steady for at least the next few weeks, that could happen by the beginning of March.
If our allocation increases, then we'll be able to move up that date. If it decreases, we may have to postpone it.
As the Biden administration takes over the program, leaders are hopeful we will see more vaccine soon.
We would love to have 80% coverage by the end of June. That would be a 6-month period of rolling out this vaccine. In order to do that, we need 3 times the number of doses we're getting now.
Some have questioned why prisoners are on this list, and they're before people who are younger than 65 but have some kind of underlying condition. Willems Van Dyke says when they're making these decisions, they were really thinking about the people who have the greatest risk of exposure and the greatest risk of spreading the virus.
Amanda Quintana reporting tonight. Amanda, thank you.